According to the CyberNext 40 report, robots will seamlessly integrate into our lives, from personal care to health systems, which artificial intelligence will be able to predict and shape the future. Joining us in the studio now to discuss robotic surgery is Dr. Mahmoud Tabbal, consultant doctor, I believe, at the hospital, at Zahra Hospital. Now, please tell us a little bit about robotic surgery and how it has become a big part of surgery nowadays. And how has the setup of the operation room changed in the past 5 years?
Thank you so much. So, robotic surgery is a new concept, relatively new in the UAE, and it's a recent thing that started in the whole world. We started before with conventional open surgery, where there is a big wounds and incisions, and patients might have suffered for some time for recovery and so. Then came the minimally invasive approach, where you do surgeries with small holes in the abdomen or in other places in the body. And the newest or the most recent, I would say, innovation is robotic surgery. So it's the same approach of having small incisions, but it's through arms of the robot that are very steady and controlled by the surgeon remotely. It's not from far away, it's from the same room. Of course. But it's of different concept of being more precise and having a lot of benefits to the patients. That, of course, changed a lot over the last years. And we're so lucky in the UAE to have the robotic systems in many hospitals now.
Of course, very advanced. Now, what kind of edge does the robotic surgery really give surgeons?
So the good thing about robotic surgery is it goes into a barrel in favor of the surgeon and the patient, of course. The surgeon actually can perform the surgery much easier. It's more flexible, control is easier, movement is not only with limited motion, it's actually more than 360 degrees, because you can move easily the arms of the robot, and it has many angles inside the body, in addition to being more precise, because the vision is actually 3D. So you actually see inside as if you're looking at a 3D I don't want to call it like a game, but it's actually something which is really very precise and very deep. That's from the surgeon point of view. In addition, the surgeon will be sitting, so he will perform the surgery very comfortably. That also reflects on the benefit for the patient, because the risks are much less.
That's what I was going to ask you. It reduces definitely the risks of, any mistakes happening because of,
It's more precise, mistakes are less, risks are less, bleeding, for example, is much less, because you see the details more, and you're more cautious when you do the surgery. In addition, the recovery, that reflects on the recovery, because the incisions are very small, surgery is easier and shorter, so patients actually recover faster, and they go back to their normal activities much faster.
Now, let me ask you about the training process. I mean, is the training machine specific or it's general? And how long does, the training take for probably a machine?
So, of course, to start with, you have to be a competent surgeon, because there are things that cannot be done by machines. It has to be done by the surgeon.
Definitely.
So once you're good in this, and you're good in somehow in the minimally invasive approach, training takes not very long. Each machine, because there are different machines in the market. Currently in the UAE, we have 2 types of machines that are used in different hospitals.
But different machines for different procedures, right?
It's the same machine. It's used in
same machine, different procedures.
Yeah, it's the same machine. You can use it in different procedures. And the training takes some time, some few days. But it's not really, the training takes few days in order to get used to the machine. With time, if you're, as I said, you're well-qualified surgeon, with time there is a learning curve that you can get it very fast. And then it's much faster than the laparoscopic approach, which is, until now, it's very common because of the easiness for the surgeon.
Let me ask you now, I'm sure there are a few patients who are iffy about, having robotics getting involved in their surgeries. Do you have any patients that opt out, and can patients opt out of,
Of course, this is a choice of the patient, but when we started the robotic surgery here, especially in our region, patients didn't understand that we are performing the surgery.
Right,
It's not
right.
the robot.
Robots,
So
yeah.
they would say sometimes, no, why shall I leave the robot to do it? And then when we actually reach to the conclusion or to convince the patient that this is actually done by us,
Right.
there was a concern that this is something new. I don't want to go through it.
Yeah, to take the risk. Yeah.
Now, because we're seeing a lot of development in the UAE in this aspect and in this way of performing the surgeries, patients are getting more used to it, and we're doing a lot of marketing in different places.
Let me finally ask you one quick question
Yeah.
now. As you mentioned, the UAE is developing quite quickly in this field. And do you think the robots will soon be controlled by AI instead of doctors? I mean, do you see this happening anytime soon?
What might happen, in my opinion, two things. Some kind of remote control, I mean controlling the robots remotely from away, but you need someone who's competent beside the patient in case anything happens. The other thing you can actually, or they can actually create some programs or systems where the AI can actually being programmed to do the surgery, but there is no way you can, because there are different patients, every patient is actually different inside his body.
Right.
So the need of the human being and our brains.
So hopefully the AI won't be taking over our jobs.
I don't think so.